metered dose inhaler. Make sure you ask your doctor for instructions about the number of priming puffs. It is important to clean and prime your MDI to prevent medication buildup and blockages. This ensures that your inhaler is working properly. Priming your inhaler involves shaking it well, removing the cover, and dispensing test sprays into the air a couple times. Make sure you hold the inhaler away from your face so the drug does not get into your eyes. You will need to prime your inhaler when it is first being used, when it has been sitting for 1 to 2 weeks unused, or whenever the canister is removed from the sleeve. There are 2 methods for using an MDI. The preferred method is often with a valved holding chamber, also called a spacer. These devices attach to the MDI and make it easier to coordinate taking your inhalers as well as getting more medication into your lungs. To use your MDI with a spacer, first take the caps off both the MDI and the spacer. Hold the spacer horizontally and insert the MDI into the opening in the rubber end. Sitting or standing with your shoulders back and chest open, gently exhale to a normal breath away from the device. Insert the mouthpiece into your mouth, past your teeth on top of your tongue with your lips nice and tight around. Be sure not to cover the slots in the chamber. Press down on the canister once all the way down, and the medication will be in the spacer. Take a nice, slow, deep breath all the way in until your lungs are completely full. Remove the mouthpiece from your mouth while holding in that breath. Do not breathe out just yet. Hold the breath in for 10 seconds. Gently let it out through your nose if possible. If a second dose is needed, make sure you wait 30 to 60 seconds in between doses. This will ensure that you are getting a full second dose. If your inhaler has an anti-inflammatory, it will be important to rinse your mouth with water, gargle, and spit it out. This will decrease the incidence of sore throat, hoarseness of the voice, or oral thrush. An MDI can also be used without a chamber. Do note that DPIs never need to be used with a chamber. Remove the cap from the mouthpiece and shake the inhaler well for 5 seconds. Sitting or standing with your lungs open and shoulders back, raise the MDI until it is near your mouth. Gently exhale to the end of a normal breath away from the device. The mouthpiece goes in your mouth, past your teeth, on top of your tongue with your lips nice and tight around. Lift your chin slightly. Start to breathe in and then push down once on the canister. Continue to take a full breath in until your lungs are completely full. Remove the mouthpiece from your mouth and continue to hold that breath in for 10 seconds. Gently let it out through your nose. If you need to take a second dose, wait 30 to 60 seconds in between puffs. This will ensure you are getting a full second dose. If your inhaler contains an anti-inflammatory, make sure you rinse your mouth with water, gargle, and spit it out. This will decrease the incidence of sore throat, hoarseness of the voice, or oral thrush. It is important that you know how much medication is left in your inhaler. The number of puffs in your MDI is printed on the top of the canister. After you have used those number of puffs, you must discard your inhaler, even if it continues to spray. Keep track of how many puffs you have used in a calendar or diary. You must include the number of priming puffs in your total. Some of the inhalers will have a counter on the back, like Advair. It will let you know exactly how many puffs you have left. If your inhaler does not have a counter, you must keep track of the doses that you are using so you know when the inhaler is empty. You will need to wash your spacer once a week. Take apart your spacer as directed on the package. Put all of the pieces in your sink or in a basin with warm water or 1 drop of a mild dish detergent. Swish all the pieces around in the soapy water and let it soak for 5 to 15 minutes. Do not use a brush or anything harsh to scrub the inside of the chamber. Remove the chamber, leaving it soapy. Shake off the excess water and leave it to dry on a dish rack or a towel. You can rinse the remaining pieces with some warm water, shake off the excess water, and leave it to dry on a dish rack or a dry towel. Do not use a paper towel to dry the inside of the chamber. This may cause a static charge. When the spacer is completely dry, put it back together. It is recommended that you replace your spacer every 1 to 2 years.